What if everybody knew what you were thinking? I think a lot of us would be arrested. Luckily, we don't know what each other is thinking, but we can hear what people are saying. And oftentimes what people are saying is not really clear because they won't really want to tell us what they're thinking. And that leads to ambiguity. Today's topic is the importance of clear, honest, kind communication. And that means not only with our team members, with our family members, but most importantly, because we're talking about the healthcare environment, with our patients. Most doctors aren't clear in communicating with their patients. They may just say what they want the patient to hear, but they won't be talking about the things that are under the surface. For example, let's say a patient has a problem that's going to lead to the loss of their teeth, or they'll have to see another specialist. It's going to cost them more than they thought when they came in. We don't want to tell them all that. So we sometimes tell the patient just part of it. And then the patient sort of knows that we're telling them just part of it, and they don't trust us. And that leads to a lack of trust, which we talked about on our last video. And then that leads to an increase in stress. And when the stress increases, they don't trust us. The relationship starts to break down. And we're both acting sort of superficially with each other. What does that mean? It means that I'm not telling the truth. They're not telling the truth. We're not really sure what the truth is. We're sort of dancing around it. And we have what's called an ambiguous relationship. Adam Grant, the professor at the University of Pennsylvania School of Wharton School of Business, talked about this in his book, Think Again, and in a recent New York Times article. He talked about that the most ambivalent relationships are the most toxic. So I have a next-door neighbor. And sometimes they say hello to me, sometimes they don't. I don't know why. I've never had any fight with them. I've never had anything but a cordial relationship. It's not just him, but it seems like my whole neighborhood is like this. It's full of ambivalent relationships. Now, since I've lived in this neighborhood, which has been about 25 years, everybody's turned over. I'm one of the oldest people in the neighborhood. Been living here the longest anyway. I've been here for close to 25 years. And so other people are moving in and they're not as friendly. They don't talk as much. It's confusing. Are they upset with me? Am I raising my voice? Do they not want to talk to me because something I've said or something one of my family members said? It's ambivalent. And every time I drive in my driveway, I look to the right, I look to the left. Is the neighbor there? Are they going to nod to me or they're not going to nod to me? And I really want to walk up to them and say, is there a problem? Can we talk about it? And I probably should, but what if there is a problem? So it puts me in this ambiguous situation. Now in my practice, in the office, I'm not ambiguous at all. I know exactly what I do. I'm there for a specific reason. I'm there to help the patients. So if a patient is upset about something, I go, is there a problem? Did I upset you in some way? Is this information you don't want? And sometimes they have a hard time having that conversation. And I can understand why. Because they're going to have to reveal something about themselves. Brene Brown talks about the power of being vulnerable. Because it takes courage to be vulnerable. And that's what I'm doing on this video with you. I'm trying to be vulnerable, explaining how I feel about certain things. But the more vulnerable I am, the more clear I am. And the more easier it is to have a relationship with someone who's being vulnerable and being open and honest. We talk about that all the time in our practice. Sometimes people get upset for something I say because they interpret it the wrong way. And, we talk about, the 4 principles, the 4 habits. And I can't say the guy's name, but is something or other. It's basically the 4 habits of something or other. But one of the habits is to not take things personally. And that's a big problem. People take things personally, and sometimes I'm not directing something at them personally. I may be saying, it's raining outside. They may say, well, it's not my fault you didn't bring an umbrella. That's a very simple example of how people get upset. But most of the time they get upset over things that are beneath the surface, what I call the subterranean level of communication. I may be saying to you, hey, can you go get me a pencil? And you may say, what? Do I look like I work for you? Or is it my fault you didn't have a pencil? Something simple like that. And that happens every day. One of my employees told me about another employee that was doing something a certain way. And that employee said to him, well, it shouldn't be done that way. And that person said, well, I think it should be done that way. So they go back and forth, but there was no clear communication. So I just found out about this today. So I'll go to the office tomorrow. I'll sit down with both employees and I'll say, hey, what's the protocol? So we're all on the same page. We were going to remove ambiguity. Should it be done this way or this way? Well, Well, there's one way to do it, and we'll do it the same way. So there's lack of ambiguity. And guess what's going to happen when there's no ambiguity? Stress is going to go away. We're going to have a lot less stress. We're not going to be arguing about that. So in your practices, in your relationships with people, try to look for areas of ambiguity, because they do exist. I have a friend now that's not calling me back. Is he upset with me? Or is he going through something on a personal level? I have no idea. I think I'm going to call him today and say, are you upset with me? Or is something bothering you personally? Let's clear it. Because I'm feeling a little bit of ambiguity and a little bit of stress. And I don't like being there. I get very little stress when I understand what I'm dealing with. An example I frequently use is walking down the street. I spend a lot of time in New York City, and oftentimes I'll walk at night and I'm on the street. And then sometimes I'll hear footsteps. Is there someone behind me? But I don't turn around and look. I ignore it. I walk ahead. But I'm not really ignoring it, am I? I still hear his footsteps. And then I turn around, and it's a cat. Don't we do that oftentimes? We don't turn around and find out what's actually there. When we find out what's actually there, we may find out it was nothing. And that removes the ambiguity. Or if it is something, if it was danger, then I cross the street. I run. I get to a place of safety. So, thought for today is try to decrease stress by decreasing ambiguity. If you have an opportunity to read the article by Adam Grant in the Times, which was published a few months ago, it's a great article on ambiguity. I strongly recommend it. It'll help you be the gift to those we serve and those we work with on a daily basis. Have a great day, everybody.